Dr. Zaheer Shah, an internal medicine specialist in Tempe, Arizona. Thank you so much for joining us on the program today. Now, there's no doubt that everyone working on the front lines of this pandemic deserves the utmost respect, so I want to take a moment to thank them before I move on. Now, COVID-19 has challenged healthcare systems across the world, especially there in the U.S., where they have the highest number of cases now. Give us some insight into what doctors and nurses are dealing with in hospitals.
Well, let me first echo the World Health Organization's report that nurses are, in fact, a very precious resource and are the backbone of healthcare systems worldwide. And it's certainly the case here in the United States. I think what the COVID-19 pandemic has shown, unfortunately, is some of the cracks in our healthcare system. I think our inability to provide both our nurses as well as other healthcare workers and doctors included with personal protective equipment like masks and gloves and gowns in order for them to protect themselves and their family members has been a bit of a national shame. It's ongoing, by the way. I'm on the front lines every day seeing patients, and we have a shortage of masks. We simply can't get enough masks to even provide them for all of our staff and all of our healthcare providers. And
Um,
I think that we're going to have consequences after this COVID-19 has settled in terms of how the healthcare workers and the nurses really view the healthcare system here.
how do you think this is reshaping the system? You said that COVID-19 showed some cracks there. Do you think COVID-19 is going to make or break the healthcare industry from this point on?
I think that it's going to cause a lot of introspection. You know, we have been over the last 20 years here in America increasingly corporatizing healthcare and taking it out of the hands of nurses and doctors and putting it into the hands of people with MBAs and who I affectionately call the suits. And what's interesting is now that we are facing a pandemic in which there are lives on the line, who have we asked to get up on the wall and stand and protect our fellow Americans? We've asked our nurses to do that. We've asked our doctors to do that. And when we put them up on that wall, these administrators and these managers and these corporations that have the most to profit from our healthcare system have been absent in terms of providing those healthcare providers with the essential tools that they need to be able to do their jobs effectively. And I don't think that healthcare workers are going to forget it. I don't think that nurses are going to forget it. I can tell you as a medical doctor, I'm on forums online every day, and there is an outrage that is national in proportions where doctors are seeing just how little they're valued by the corporations for whom most of us work.
All right, Dr. Zaheer Shah, we wish you the best of luck in the fight against COVID-19. Thank you so much for joining us on the program today.